Good evening, everyone. A very warm welcome to this new initiative by Medanta, the Medicity, which is called as TAREEKH, BAJE. So that all of us remember this catchy phrase, all that it is meant to be is to disseminate information about cancer, the disease which manifests in various forms, affects various organs of the body, and many specialists, many professionals, apart from doctors, are involved in treating each individual patient. However, our endeavor would be to spread this information on a social platform in an easily understandable manner. And I welcome everyone who's found time to connect with us this evening. Our initiative aims at connecting with the general public, patients, families, survivors, caregivers, NGOs, and anyone who's interested in gaining more information about cancer, its prevention, the coping strategies, because we would have over the months diverse programs. And I'm joined by some of the top specialists from Medanta Medicity this evening. First and foremost, I would invite Dr. Naresh Trehan, who's the Chairman, Managing Director, and the founder, the father of cardiac sciences in India, to bless us and address today's program and give it a go ahead. Thank you so much. Over to you, sir.
Good evening. I am Dr. Naresh Trehan, the Chairman and Managing Director of Medanta, the Medicity, and also the Chief Cardiac Surgeon. As we have seen that the incidence of cancer in our country is growing very fast, we've got very concerned about the public's awareness of how cancer happens and how they can actually try to save themselves from it, how they can detect it early, what are the treatments available, and how to actually steer your life through this whole fear of cancer being around us. And that for that purpose, Medanta is starting a new program on the web, which is known as TAREEKH, BAJE. This has been chosen as the title because everybody can remember that on that particular day, at that particular time, that is 7th of each month at 7 p.m., there will be this education program, awareness program, done by the experts of Medanta Cancer Institute to communicate to the public what are the actual facts about cancer and how to deal with them. As Medanta has a very large, super specialized cancer institute, this will help the public in understanding and recognizing if anyone has cancer around them or what are the causative reasons why cancer happens and how to prevent that from happening. So, this, in our belief at Medanta, as part of our obligation to educate the society and to help them to actually save themselves from cancer and also to do early detection for cancer and to do the right treatment for cancer and also the follow-up for cancer. In that duty, we want to communicate this on every 7th of a month at 7 p.m. This will be accessible to you on the web, live, given by the best experts of each super specialty in cancer by the chairman of different departments and HODs of different departments of the cancer division. So, I hope it will serve the purpose with which we have actually planned it, that the public will receive information by the experts, giving them or empowering them how to deal with this dreaded disease. Thank you. Look forward to your participation in this TAREEKH 7 BAJE program, which is only designed for the public and for you. Thank you very much.
Thank you so much, sir, for your encouraging words and setting the context. And we do hope that we live up to your expectations as well. Ladies and gentlemen, we would begin with the presentations. And to kick off the presentations, I would be taking you through some of the basics about cancer, the numbers, and why this disease should be tackled, not only tackled, but why the information should be disseminated on a very urgent footing, because the numbers, what you would see through the presentation, are very compelling. Is my slide visible?
Yes.
Thank you. So I would, ladies and gentlemen, speak about the prevention of cancer. My name is Ashok Vaid. I work at the Medanta.
Yes, sir. Please go ahead.
Okay. Due to internet issues, I think we're getting disconnected. But I'll start with the blood cancer awareness program for today. So good evening, and thank you for everyone for joining. Today, since this is an introductory program, I wanted to talk to you about just an introduction of the types of blood cancers. And
Your screen is not visible.
Okay, thank you. After a shaky start, we'll start again. So good evening, everybody. Thank you for being here today. I just wanted to talk to you about blood cancers. And since this is an introductory session, it's going to be a brief introduction of blood cancers, their types, and essentially I'm going to tell you about how to diagnose them, how do doctors diagnose them, what kind of symptoms to look out for if you're suspecting for someone to have a blood cancer. So blood cancers, simply put, are types of cancers that start in the bone marrow where the blood is made, or they can start in the lymphatic system. And blood cancers affect the production and function of blood cells. Blood cells are essential for our survival because the bone marrow is making blood cells by a huge amount every day, every hour, leading to the production of red blood cells, which give us, which transport oxygen for us, making us live a healthy life, and providing oxygen, which is a vital ingredient to all the cells. Uh, um, the white blood cells, which help us fight infection from now and then there are little cells called platelets, which help us prevent bleeding or bruising. So because of these, this can lead to a range of symptoms and complications, which we are going to discuss in the next 5 to 10 minutes. So mainly there are three types of blood cancers, and everybody would have heard the terms called leukemias, lymphomas, and myelomas. And each of these type of blood cancers affect a different type of the blood cell and has different symptoms and treatments associated with them. So starting with leukemias, many of us would have heard the term leukemia, and it's a scary term. It's simply put, it's a type of blood cancer that affects our white blood cells. And white blood cells are the cells that are responsible for fighting infections in the body. And they're all over the place. They're produced in the bone marrow, they come in the blood, they help us fight infections. But when somebody has leukemia, their bone marrow produces abnormal number of white cells. And these abnormal cells don't do their normal function, and because of which the body is exposed to infections. And sometimes because these cells are too many, they can lead to symptoms of leukemia. And broadly put, symptoms of leukemia can include fatigue or tiredness, thakan, kamzori, because there is less hemoglobin in our body, less oxygen is being transported. So our tissues are starved of oxygen. They can lead to fever, and which can be frequent, which can be recurrent. And fever is because we're getting infections again and again. And frequent infections can be infections of the chest, of the urinary tract, or even the bloodstream. And finally, easy bruising or bleeding. And that's because we lack platelets, which are essential cells for preventing us from bleeding or bruising. So there are several types of leukemias. There are the chronic leukemias, which are the slow growing ones, and they take time to be detected because they will take time for symptoms to happen, and the patients or people who've got chronic leukemias will take time to get to their doctors because the symptoms are chronic and they gradually build up. But then there are the acute leukemias, which happen very quickly, and they make the patients very unwell very quickly, which is why they get to the hospital quicker and they get diagnosed by a simple blood test. So the other type of blood cancer I wanted to highlight here were the lymphomas. And lymphomas are slightly different because lymphoma is a type of blood cancer that predominantly affects the lymphatic system. A lymphatic system is a system which is parallel to our blood system, and it helps us fight infections, especially infections like tuberculosis and the infections that are fought by cell-mediated immunity. Not only does the lymphatic system fight infections, it is responsible for removing waste from the body through the lymphatic channels. Lymphomas can be of various types, and they affect lymphocytes, which are the special cells that live inside the lymph nodes and within the lymphatic system. A lymphocyte is a type of white blood cells that helps body fight infections. So symptoms of lymphoma can include enlarged lymph nodes, and all of us would have had lymph nodes now and then. If we get a sore throat, the neck nodes become bigger. If we get injury in a particular area of a body, the local node of that area can swell up. They can cause fatigue, fever, something called night sweats. And night sweats just means so much sweating that your clothes get wet and even your bed sheets can get wet. And so it's just more than simple sweating. And they happen at regular intervals, and they happen more and more frequently if the lymphoma is progressing. And finally, weight loss, which is a symptom associated with nearly all cancers. But in lymphomas, it's quite marked and it's quite predominant. So finally, there are the third type of broad category of blood cancers, which are called the plasma cell disorders. And by definition, that means they involve the plasma cells. And plasma cells are the cells which live inside the bone marrow and help us make antibodies. And antibodies are the proteins that help us fight infections. So if there are abnormal antibodies, we can't fight infections, and infection again can happen in all plasma cell disorders. The commonest plasma cell disorder that we will hear about are the multiple myelomas. And multiple myeloma again is a type of blood cancer that affects the plasma cells in the bone marrow. If the plasma cells, there is an abnormality in the plasma cells and they start to grow, not only will they make abnormal antibodies, they will also make an abnormal protein that we can detect in the blood. And these antibodies that they make cannot fight infections as effectively as the normal antibodies can. Which means that our body gets prone to infections. So because myeloma cells can accumulate in the bone marrow, they can damage the bones from the inside, leading to bone pains and even weakened bones. And a lot of patients with multiple myeloma will present with a broken bone or a fracture with a minimal injury that otherwise would not cause a fracture. Because there is an increased risk of fractures, patients have pain all over the body, especially in areas where there is a lot of myeloma present. So the symptoms of myeloma can not only include bone pain, it also includes fatigue because the bone marrow is not doing its normal job of making hemoglobin. It can include recurrent infections and even sometimes bleeding or bruising. So if you or someone you know is experiencing any of these symptoms that I mentioned with the different type of blood cancers, it's important to talk to a doctor directly. Blood cancers are typically diagnosed through blood tests, so they're not very difficult to diagnose. It's a simple blood test. But if you need detailed information about these blood cancers or their types or what kind of treatment to give, typically your doctor may recommend a bone marrow biopsy and some imaging tests to find out how far the lymphoma, leukemia, or the myeloma has spread. An important point to mention here is that early diagnosis is the key to improving outcomes for all blood cancer patients. And that's typical of all cancers, not only blood cancers. Because the earlier you treat, the lesser the burden of cancer you're addressing, the lesser the complications that are happening to the body, like broken bones or infections or bleeding or bruising episodes. And so treatment for blood cancer depends on the type and stage of the cancer. So the earlier you treat, the better it is, as well as the individual patient's health and preferences. So the treatment for somebody who's older has lots of other problems would be different as compared to treatment for somebody who's younger and has no other problems. So typically that means the kind of treatment that we can give a younger patient with less comorbidities or less other problems can be more aggressive and can treat the cancer more effectively. So the common treatments include chemotherapy, which in general means injections or tablets that will kill all cells, not only the cancer cells. So by definition, chemotherapy is a type of treatment that can cause some complications, and it is important that you discuss this with your doctor. We can also use radiation therapy, which is strong X-rays to address local areas of cancer. And you must have heard a lot about targeted therapy, which is typically monoclonal antibodies or specific drugs that target specific pathways that can only target the cancer cells and leave the other cells unharmed. Some of the blood cancers will also need something called a bone marrow or a stem cell transplant. And we will discuss this later on in the subsequent episodes of this program. The supportive care, such as pain management and blood transfusions, are also essential parts. They manage symptoms, they keep the patients comfortable during the treatment. And in addition to medical treatment, there are many resources available to support blood cancer patients and their families. These resources typically include support groups, counseling services, financial assistance programs, and educational material. The more you know about your cancer, the better you can face the challenges that the cancer throws at you. So one of the biggest challenges facing blood cancer patients is the emotional toll of the disease. And this is where the ancillary therapies of yoga, meditation, physiotherapy comes in. A diagnosis of blood cancer can be quite overwhelming and stressful, and it's important for patients to have access to emotional support. So we have counselors which are dedicated to this type of support. So if you or someone you know is living with blood cancer, I encourage you to seek out support and resources that can help them. So in conclusion, blood cancers are a serious and complex group of diseases that affect many people around the world. And while the diagnosis can be difficult, there are many treatments available and resources to help patients and their families manage the disease. If you're concerned about blood cancers or experiencing any symptoms, don't hesitate to your doctor. Talk to your doctor and do it early. So thank you for listening. I hope this information was helpful, and I'm going to pass the mic back to Dr. Vaid.
Thank you, Dr. Nitin, for that wonderful exposition in a very simple format, very understandable. And as you said, that we would be discussing in subsequent episodes about the specifics of the blood cancers, bone marrow transplants, and we would also delve on treatments individually, hopefully for the acute and the chronic leukemias and the blood cancers in the subsequent episodes. My sincere apologies for the interruption due to the internet issues at our end. And let's move on. And I take this opportunity to invite Dr. Sabhyata Gupta, who's the chairperson of gynecology, gynec oncology, and gynec robotics at Medanta, the Medicity, to tell us about the gynec cancers, the women's cancers, and gynec in particular. Over to you, Dr. Sabhyata.
Yeah, thank you, Dr. Vaid, and good evening, ladies and gentlemen. I'll be speaking on the preventive measures and early detection of gynec cancers. And I'll start with a short presentation, some slideshow. Can I have the first slide, please? Yeah. So when we talk of, one second. When we talk of gynec malignancies, then, certain things which come to our mind are the various organs which are there. And that is ovarian tumors, ovarian cancers, endometrial carcinoma, cervical carcinoma, vulvar and vaginal carcinoma. Next slide. So that's what I wanted to say, that these are the organs which get affected during malignancy, and these are the gynec organs. And next slide, please. Yeah. So if we see that, what we need to understand is that the two ovaries are there, then there's a uterus, then there is a cervix, which is the mouth of the uterus. We need to understand that the cervix, when we say the cervical cancer, it is this part of the uterus, which is the mouth of the uterus, which gets affected, which gets cancerous disease, and that's called cervical cancer. And lower down, it's the vagina, and then comes the outer area, that's a vulva. The vulvar and the vaginal cancers are comparatively much less common. But what I would like to tell you is that if at all you get to have some discharge which is abnormal, or there is any discoloration of the outer skin, or there is itching, then of course that's the time you must go and visit your doctor, must talk to your doctor, and they will let you know whether it is something cancerous or it's just some simple skin disease. Next slide, please. So this is the same, I think, and then coming on to the next part, that's the prevention and early detection. Whenever we talk about it, what we need to know is that awareness is the most important thing. And awareness not from the net, it's the actual information which is important. And the second is that, of course, you should have an access to the medical care facility. Next slide, please. So when we talk of prevention, and more so in the gynec cancers, I'll say that we need to know the risk factors. We need to know whether there's a screening modality available or possible for that particular cancer or not, whether vaccination is there, and if at all there are any risk-reducing remedies, they are to be adopted. And for early detection, of course, you need to know the symptoms of the disease. And then, of course, once you know the symptoms, and if at all you get to feel them or you're experiencing them, you must go and consult a doctor so that the early management can be started and you get better results. Coming on to the ovarian cancer, if you start with ovarian cancer, what we need to know is that what are the risk factors? What makes you more prone? So if at all somebody is having hormone replacement therapy, some exposure to asbestos, if you smoke, tobacco smoking is also linked with it. If the menarche starts early, you start menstruating earlier on in life, and the menopause happens very late. That means long exposure to estrogen hormone. That is again a risk factor. If you don't get pregnant and if you don't deliver children, and if at all you deliver at a later age, say after the age of 35, the risk slightly increases. Then at times there can be some hereditary factor which is affecting you. Maybe it's something like BRCA mutation, BRCA1, BRCA2, MSI. If you have a family history wherein you have ovarian cancer in the family, your immediate first degree relatives, they have ovarian cancer, 2 or more of them, or you personally have a breast cancer at an age which is less than 40 years, or if you have breast cancer at an age, say, earlier than 50 years, and you have some personal history of, some family history of ovarian cancer, then you are more prone, the risk factor is higher. So this is what you need to know for the ovarian cancer. As far as the screening is concerned for ovarian cancer, it's not recommended for general population, only if you have hereditary risks. As I said, if you have BRCA1 positive, BRCA2 positive, or MSI, then of course, then is the role of screening. That for BRCA1, it is recommended that after the age of 30, between 30 to 35, you start getting screened. And for BRCA2, it is after the age of 35. There's no vaccination for it, but of course, the risk-reducing remedies are there. So if you're BRCA1 positive or BRCA2, then it's a good idea that after the age of 40 or once you have completed the family, you can go for the risk reduction surgeries. Coming on to the symptoms for ovarian cancer, the symptoms are very general, and that is why it's called a silent killer, because it gets very late. When it gets diagnosed, invariably the patient is in stage 3 or 4. The symptoms are very vague, normally attributed to some GI symptoms. Maybe, there is loss of appetite, there is dyspepsia, indigestion kind of a thing, fullness. You feel full immediately after eating food. And pelvic pain, abdominal pain, distension abdomen. So these can be various symptoms for ovarian cancer. So if at all you feel such kind of symptoms, it's a good idea to go and consult a doctor. If we come on to the uterine cancer, that is the main body of the uterus, the womb. In this, the cancer which happens in the lining of the cancer, again, the risk factors are obesity. It usually happens in postmenopausal ladies, but younger patients can also, younger girls, younger ladies can also have it. So any abnormal bleeding is to be reported. More so the postmenopausal bleeding should be reported. Any bad discharge, any abnormal discharge from vagina is to be reported. Screening is not recommended in general, but yes, there is a syndrome where, again, a hereditary syndrome where the colon cancer is also there. The history can be there. And in that case, of course, screening is recommended after the age of 35. And they that your doctor will do something like a DNC or endometrial sampling, we call it, or so that is to be done. And coming on to the early detection, we need to know the symptoms. We just discussed the symptoms. The prolonged exposure to estrogen again is a risk factor here. So early menarche, late menopause is a risk factor. And if we talk of the cervical cancer, this is one cancer which is 100% preventable. So if we take the preventive measures, so you can actually assure that this cancer will never happen to you. And so the risk factors are that if your immune system is compromised, or if you smoke, then the risk goes almost double. It gets double. And excuse me. And other risk factors are early sexual debut or having multiple sexual partners. So these are some risk factors, and the symptoms are, there can be a vaginal discharge which is abnormal, there can be blood-stained discharge, there can be bleeding after intercourse. And coming on to the screening, this is, as I said, that it is a cancer which is 100% preventable. So screening plays a very important role. And then, of course, vaccination is also available. That's a preventive vaccination. And the vaccination can be given to girls above the age of 9 years. And it is said that it's better to give it early on. So earlier the better, because this is a time when the immune response is best. So for the girls between the age of 9 to 14, 2 doses of injection are recommended. Now, in fact, there's a lot of literature coming up which says that even one injection is good enough. In recent guidelines, they say that even one injection is good enough for these girls. And after the age of 14 to the age of 25 and even higher up to the age of 45, one can have 3 injections. And when we give 2 injections to the girls between the age of 9 to 14, then the gap between the first and the second dose has to be more than 5 months. It should be 6 to 12 months. And if you are taking 3 doses, then the schedule would be that you take 1 injection today, and the second one is taken after a month's time or 2 months' time, and the third injection is taken 6 months from the first dose. Coming on to the screening, it is a modality which is meant for all ladies who are not symptomatic. So when you're not suffering, that is the time when you have to go to the doctor. So all healthy ladies should go and get the screening done. And the first choice of screening modality is the HPV testing. So at least 2 tests should be done, one at the age of 35 and the next first at the age of 30 and then the next at the age of 45. And if this is not available in your area, if this test is not available, then I think something like a pap smear, or, better would be that you go and talk to your doctor, ask for a screening test. So whatever best modality is available in your area, you should adopt that. And this way, of course, with vaccination and screening, we can prevent it 100%. Even after vaccination, what we need to know is that screening is a must. So all the ladies, even after getting vaccinated, should get themselves screened. And screening is recommended after the age of 21. Hello. So that is it from my side. So for cervical cancer, prevention is available. Screening and vaccination is the modality. And for the other cancers, you need to know the signs and symptoms. You need to report early and must go and see your doctor and take the right management protocol. That is from my side. Over to Dr. Ved.
Thank you, Dr. Sabita, for educating us about the common women's cancers, the symptoms and the preventive strategies, and also talking about the very important aspect of family history and the impact of family history in some of these cancers. And I think with that, we come to the end of these two presentations which were more oriented towards the disease of cancer. And let's move on. And I have the privilege of inviting Mrs. Lakshmi Sudha Parthasathi. And with that, we would switch.
Thank you, Doctor. Yes, thank you, Doctor teams. It's a very wonderful information. So, अभी हम योग के towards देखेंगे because yoga is as scientific as it is spiritual. Okay, so it is a way of living. Yes, yoga believes that when you are pranic energy is flowing. Okay, so it will help to heal very easily. So आज हम हमारा प्राणिक एनर्जी को कैसे बढ़ाएंगे, कैसे हम प्राणिक एनर्जी के थ्रू हमारा हीलिंग को और आगे बढ़ा सकते. So we're going to look into that. Okay, so एक छोटा सा 10 मिनट का एक प्राणिक एनर्जाइजेशन टेक्निक के थ्रू हमारा योगिक ब्रीदिंग के अंदर जाएंगे. So sit on a very comfortable position. जो भी आपको कंफर्टेबल लग रहा है उस पोजीशन में बैठ भी सकते हो और आप लेट के भी बेड में लेटे हुए भी आप कर सकते हो. ओके, सो कुछ नहीं करना है, हम जो भी कर रहे हैं अवेयरनेस के साथ करना है. कॉन्शियस, अवेयर, बी present with the moment. That is what we're gonna do. Okay, it's not very hard and fast, nothing. So just be comfortable. Just sit on a cool position, comfortable, or maybe lying down, relaxing your back completely. Okay, now let's start with it. So look around with a conscious awareness. Look around your room with full consciousness and slowly, gently close your eyes. A good smile on your face. ये end तक ये smile रहना जरूरी है, क्योंकि ये बहुत ज़्यादा जरूरी है. Because when you smile more, you feel that happiness from inside. So feel that happiness from inside. Watch your breath. हम एकदम छोटे बच्चे थे, हम पैदा हुआ थे तब से ये breath तो running. But have you ever aware of that? No. So आज हम कुछ पल लेंगे उसको observe करने के लिए. Observe the incoming and outgoing. Eyes are closed. A good smile on your face. Just observing incoming and the outgoing. Without manipulating your breath, and very smoothly, or maybe irregular. Maybe one inhalation is longer, maybe one exhalation is longer. Fine. Observe your breath. Yes. Now you can observe that slowly, slowly it's falling to a rhythm. Just watch that rhythm. You're not manipulating your breath at all. Outgoing breath. Slowly watch your belly movement. Belly breathing or diaphragmatic breathing. When you're inhaling, your belly is coming out. While you're exhaling, your belly is getting down. Inhale, belly out. Exhale, belly inside. Continue this for a few more breaths. Inhale. Belly is coming out. While exhaling, your belly is sinking down. Might feel without your intention, the breath is going deeper and deeper. Observe it. Nothing you're going to do here, just observing your breath, awareness of your breath. Without stress, without any force, without manipulating your breath. Belly is coming out while you're inhaling. Exhaling, belly is getting down. You for 2 more breaths here. You're not manipulating it, you're not lengthening it, you're not shortening it. Only we're going to do chest breathing. While you are inhaling, your chest is expanding. It's happening all the time, but we never ever looked around it. While your chest is expanding on the side and it is coming forward like a balloon. Lungs is also like a balloon. It's expanding on a 3 dimension. You could see it now. Yes, it is working as like a balloon. I never ever observed it. Yes, watch it. The rib is expanding and slowly sinking back down. Inhale and slowly exhale. And inhaling, your chest is expanding like a balloon. And while you're exhaling, it's sinking down towards your spine. Continue this breathing without manipulating your breath. We're going to move yogic breathing. You're going to watch, take full lungs full and emptying your lungs completely on each and every breath. Inhale, belly comes out and your chest is expanding. Exhaling, your chest is sinking down to the center and slow as your belly coming back towards your spine. Inhale, chest flows up, belly comes out. Exhaling, chest shrinks down, and your belly is as well going down. Continue this. 2 more breaths. Yes, taking the breath as much you could in your lungs, and while exhaling, emptying it as much you could. Yogic breathing. Full awareness. Feel your chest movement. Feel your belly. Just a few more breaths. Don't forget the smile. Don't get stressed out. Just be aware of your conscious. Slowly release awareness from your breath. Watch your body. Is there any pain in any part of your body? maybe your legs, maybe your hands, or maybe your head, wherever you would feel some pain, observe that pain. What kind of pain it is, what you done. Either throwing, or a stabbing, or a shooting, or it's just a dull ache. Observe it. Observe that does the pain increase when you inhale or does it increase when you exhale? Is there any difference? Just a minute, step into the pain. Observe the pain. Inhaling, is it increasing? Or while exhaling, is it getting down? Observe it. Exhaling, release the pain completely. While inhaling, feel the energy. So, to your head, there is a healing light coming towards your body. Inhale that light, take the energy. While exhaling, throw out all the stress and all the questions. Why me? How? When? Release all those questions away. Inhale. Feel the energy. Yes. Getting the new energy. While exhaling, I'm releasing all the stress. Inhale. Awareness. Yogic breathing. Exhale. Release. Every breath, feel like I am healing. I am healthy. Every inhalation, repeat it in your mind. I am healing. I am healthy. Every inhalation, like I am healing. Every exhalation, yes, I'm feeling much better now. Mind plays a major role. Now with the awareness. Continue this affirmation 9 times on your mind in your own mother tongue. Either it may be any language, Gujarati, Marathi, Marwari, Hindi, any language, English, whatever the language, mother tongue. So repeat it 9 times. I'm healthy, healing, like a short words, short sentence. I'm feeling better. I will be fine soon. Like your own sentence, repeat this for 9 rounds on your own mother tongue. Without any negative words. Let's start with 9 rounds. Every inhalation, healthy. I am healing. I'm better now. Just live that moment now. Whatever you said through, you are getting it. Feel like I'm healthy now. I'm healing. I'm better. Feel it. Feel that moment. Live in that moment for Second, feel it. Feel from inside. Feel that happiest moment. And better now. Feel it. And stay still. Let's end up the session with ending sloka. Inhale. Om Sarve Bhavantu Sukhinah. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma Kakshit Dukha Bhag Bhavet. Om Shanti Shanti Shanti. May everyone be happy. May everyone could see what is good. May everyone stay away from all the worries and pain. Shanti, Shanti, Shanti. Your hands nicely, generate a heat. Keep your eyes still closed, keeping it over your eyes. Wipe out your entire face, placing your hands in front of your face like a mirror, a good smile on your face. Slowly, gently open your eyes and look at your Namaste, namaste. Thank you, Dr. Steen. Thank you for giving me this wonderful opportunity. Thank you. So over to you.
Thank you, Sudha, for that wonderful session. And it actually brings out the energy within you and also relaxes. Thank you so much. We appreciate your time and the session you took us through. I think we have some questions from the participants. And first comment is by Mr. Arya. He says that this is a step towards awakening the human beings on health concerns, and he's very thankful to Medanta for this initiative. Now, Nitin, there is a question by Mr. Surendra Kumar, and he's asking about ITP, which I know we can't discuss individual diagnoses and treatments, but if you could just offer your comments on the ITP issue.
Yes, of course, sir. So his question is, हमें ITP है, इसके बारे में जानकारी प्राप्त करने की कोशिश करते हैं. कृपया इस बारे में जानकारी दें. उत्तर प्रदेश से हैं मिस्टर सुरेंद्र कुमार. So ITP is एक ऐसी बीमारी है जिसमें हमारी इम्यूनिटी हमारे प्लेटलेट्स के अगेंस्ट हो जाती है. And that immunity tries to kill our platelets, and platelet count goes low in the body. And because of that, because platelets are cells which prevent us from bleeding or bruising, the low platelet count can cause things like bleeding just under the skin or bleeding from the nose or the gums, and can sometimes also cause serious bleeding. So it is a disorder that needs to be treated urgently and diagnosed urgently. And usually the standard first-line treatment is steroids. So if there is a suspicion of ITP, you should go to your doctor, get it checked out, and get treatment as soon as possible.
सुरेंद्र जी, आई होप ये जानकारी आपके लिए ठीक रही, पर्याप्त होगी. एंड किसी इस माध्यम से हम जुड़ना चाहेंगे वापस, एंड हमें उम्मीद है कि एक दिन हम ITP पे भी चर्चा करेंगे. एक क्वेश्चन, देयर इज अ क्वेश्चन बाय मिस्टर अरोड़ा अबाउट द ब्रेस्ट कैंसर ट्रीटमेंट दैट द थेरेपी हैज स्टॉप्ड वर्किंग नाउ. Mr. Arora, it does happen that with advanced cancers, the tumors do start getting resistant at times, and the previous treatment might not work anymore. And we have to change treatment, switch treatment based on the tumor characteristics. And I'm sure your doctors would continue to explore those possibilities and then find the best treatment for your daughter. There is again a question about the breast cancer conservation surgery. followed by radiation. And there are, I think, again, the individual treatments probably may not be feasible. In this episode, we will have an episode on breast cancer soon enough, and we would be dwelling on the various treatments, causes, the prevention strategies, early detection strategies for breast cancer. Till then, let's hold the discussion on breast cancer. Now, there is a question by Aishwarya Jaina about pap smear. Is it necessary before going for cervical cancer vaccination? Dr. Sabhyata, your comments about this.
No, pap smear is not necessary, but by itself, it's important. So for vaccination, it is not a prerequisite. But all the ladies after the age of 21 or all those who are sexually active should get their screening done. It can be pap smear or it can be HPV testing. So whatever you opt for, certainly, as I said, that now there's a shift towards HPV testing. So that's a better modality. But if that's not available, then maybe pap smear or other modalities can be adopted. But that is not a prerequisite for the vaccination. As I said, that these are to be given, these vaccinations are recommended for very young girls also. So after the age of 9, we can give the vaccination. So obviously, pap smear is out. So it's not a prerequisite. Even for elderly ladies also, they can take the vaccination. I mean, the young ladies up to the age of 25 or maybe later on also can take vaccination without getting the pap smear done. But pap smear by itself is very important, or the screening by itself is very important, and that's a separate thing altogether.
So that's a very clear message. No pap smear is recommended before taking cervical cancer vaccine. Mr. Suresh Sharma is asked about CLL. Dr. Nitin, he wants you to tell about CLL, if you could offer your comments.
Yes, sir. So his question is, kindly tell about CLL and when can we start treatment for CLL? So CLL, for people who don't know, is chronic lymphocytic leukemia. And it's one of the indolent forms of leukemias that grow very gradually. And the question is a very important question and a very good question, because when we diagnose CLL, and it's being diagnosed earlier and earlier with routine blood testing now, when we diagnose CLL, if the CLL is not causing any problems and not causing any bone marrow failure, meaning the hemoglobin is normal, the platelets are normal, then it does not usually need treatment at diagnosis. The signs and symptoms that somebody should look out for starting treatment are recurrent fevers, night sweats, and weight loss. But till that happens, a regular follow-up every 3 months is recommended, and make sure that you see your doctor every 3 months.
Dr. Nitin, you could take up the next question as well by Priya Khatri. Does everyone with cancer get anemia? Because you are the anemia specialist. I think it will be appropriate if you offer your comments on that.
Yes, sir. So that's a very important and a good question. So anemia is one of the complications of most cancers and even most cancer treatments. So anemia can be multifactorial and can be because of various reasons, not only because of the cancer, but also because of cancer treatment or effects of cancer. So some cancers lead to bleeding, which can cause anemia. Most cancer treatments lead to poor nutrition, which can cause deficiencies of iron, B12, folate. So it's and sometimes bone marrow suppression is one of the reasons for or side effects of one of the cancer treatments. So it's essential that your doctor does appropriate tests to find out what the cause of the anemia is, if there is one cause or multiple causes, and then address them individually to optimize the hemoglobin while the treatment is ongoing.
So, Dr. Nitin, you could continue with the next question as well, that will there ever be a permanent cure for blood cancer?
Again, a very pertinent question. I think there are many blood cancers now which have a permanent cure, and cancers like chronic myeloid leukemia, Hodgkin's lymphoma to a large extent, and many other cancers which have got very effective treatment. Cure rates are fairly high for acute leukemias, for patients who can undergo a stem cell transplant, and certain lymphomas. So the answer to that question is a bit convoluted, but generally means that there are high chances of cure with a lot of cancers. But even if a cure is not possible in places like myelomas, the very effective treatment is available. And make sure you get that treatment, and sequential treatment sometimes may be needed to keep the cancer at bay.
Excellent. Can stress cause cancer? That's a question by Anubhav Bhargav. And any of the experts would like to take it, or you want me to offer my comments?
I think it's a you question, sir.
So there have been a lot of studies to address these issues over the last several decades, and people have looked at different professionals, different the population groups to understand the effect of stress. For example, a simple stress factor, that sleep deprivation, can that cause more cancers? Can crossing time zones cause cancer? Long flights where you are starting in one part of the world and landing in 10, 12 hours or 15 hours in a different part of the world. All these have been subject of intense research in medical science. Incidentally, there has been no direct causal relationship till now. And so one cannot say that stress would cause cancer to anyone as a directly linked topic, as much as tobacco is linked to cancer, or many other factors. Viruses are linked to cancer, or the family history is linked to cancer. So it's not as simplistic about it. So the next question is, what are the chances of recovery after treatment? Dr. Sabita, in the gynec cancers, if you could offer your comment that what would be, and then Dr. Nitin, if you could sort of talk about the rest of the cancers. You did talk about the blood cancers, leukemias, and we could talk about lymphomas and myelomas as well. Dr. Sabita.
So now the science has progressed so much that the survival rate and the recovery is good after the treatment. But what we need to understand is that earlier the better. If the disease is diagnosed in the early stage, of course, then the recovery and the survival and everything is better. And if it's diagnosed in a late stage, then of course it gets difficult.
So before Dr. Nitin comes in, there is a related question that how will cancer affect fertility? I think Dr. Sabita, you are the specialist on that. If you could pick up this.
Yeah. So there are certain chemotherapeutic agents which are invariably given for various cancers, and some of them are there which can cause fertility impairment. They affect the fertility. Then even the radiation therapy can also affect the fertility. And so, once you are interested in preserving the fertility, you have to talk to your doctor. And then, of course, they'll choose a drug which is not going to compromise the fertility. That is one. And the second is, if we come on to the gynec cancers, then in the early phase, an early stage, we can offer a fertility sparing management to the patients, be it cervical cancer, be it ovarian cancer, be it uterine cancer. In early stages, of course, fertility preservation can be done. But if the stage is after the second stage or onwards, then it gets difficult.
So it's essentially the surgical procedure itself, drugs, radiation, all of them can hamper. And Dr. Nitin, there are two questions. I think there is one more which has popped in. Your comment about the outcome of the treatment and broadly in cancer. And there is another drug, lymphoma cancer after bone marrow transplant, success rate kitna hai? So if you could offer your comments on that.
Yes, sir. So I'll take the lymphoma one first. So lymphomas usually need a transplant if the lymphoma has come back, which means a relapsed lymphoma. Generally, the standard of care is a type of a transplant called autograft, which means the patient themselves are the donors. And with lymphoma transplants in a relapse situation, we can push up the success rate or long-term cure rates to up to 40 to 50%. Without a transplant, the cure rates are very low, which is why transplant is now the standard of care for most lymphoma transplants. The other question about the success rates in lymphoma in general, because lymphoma is a very heterogeneous and widespread disorder, every lymphoma and every type of lymphoma, stage and grade of lymphoma has different success rates, and success rates can vary between 30 to 90%. Generally speaking, Hodgkin lymphomas have got very high success rates with treatments. And there's certain types of aggressive B-cell lymphomas which have got high success rates. But then there are lymphomas which don't respond very well to treatment, or even if they do respond, the lymphoma tends to come back, needing transplant-like therapies or high-intensity therapies, where the success rates can be as low as 30 to 40%. So it's very important that you speak to your doctor who's treating you to understand the chances of success in your situation and what kind of salvage therapy or transplant you would need.
Sudhaji, there is a question about, can yoga really help in cancer?
It's a very good question because it can work on the symptomatic pain. Okay, so it can smooth your mind. It can help to come out of the pain. Okay, so that you can be calm yourself. You can face it. So that's the immunity from your mind. You will get to face it. Yes.
Thank you so much. There are questions specifically about certain tumor types like brain cancers and all that, urinary bladder. I think my request would be that we hold these questions. We would be coming in subsequent episodes individually on these disease entities and have greater discussion on that. There are questions related to diet. I will be towards the end, as part of my conclusive slides, I would show you the impact of diet and what are the recommendations, what are the do's and don'ts in your lifestyle you should be doing, and hope that would answer these questions. And there is a question about that, Dr. Sabhyata, what is the most common cancer in women?
It is breast cancer, followed by cervical cancer, then comes the ovarian cancer.
There is another question about the commonest cancers, and the answer to women's cancers is already there. And amongst men, lung cancer is the commonest in India. So lung cancer and head and neck cancers are the commonest cancers. And mind you, they are both tobacco dependent. I would show you in the concluding slides, as I said earlier, about the lifestyle modifications, what one should do. There is a question about the treatment of breast cancer during pregnancy. Yes, treatment is feasible, treatment is done. Depending upon the gestation, how old the baby is, the treatments are modulated and treatments are offered to patients during pregnancy as well, with successful outcomes. And of course, the treatments would be modulated so that we don't harm the baby, we don't harm the mother as well. So I hope I have not missed any of these questions. There is a question about how is immunotherapy for cancer treatment given. Dr. Nitin, if you could tell us about the role of immunotherapy broadly in cancer.
Yes, sir. So immunotherapy is a specific type of treatment that targets only the cancer cells, and by definition, unlike chemotherapy, spares the normal cells, which means immunotherapy will cause very few side effects. Some of the side effects of immunotherapy are infusion related, because immunotherapy is given as an IV infusion. Sometimes patients can get fever, chills, rigors, or even their blood pressure can fluctuate because of the foreign protein going into their system. But usually these reactions are mild, and usually these reactions can be controlled very easily. So it's important that the first immunotherapy injections are given within a good hospital setting where these side effects can be managed very well.
Thank you so much, Dr. Nitin. And I'm looking at the watch as well, and we are almost coming to the close of our allotted time. And please allow me to share the screen and offer some comments about diet, lifestyle, and other measures one can adopt. Can you see my screen?
Yes, sir, it's visible.
So let me carry on from where we left earlier. I think we have talked about the various sides. Colleagues here. I hope everybody is enjoyed the program. This was informative. This would help not only gain more knowledge, empower themselves and in their own lives, but also disseminate the information to those who have not been able to participate on this program. It's time to close the program now. And before I do, I would request my colleagues here to offer their comments, closing remarks. Dr. Sood.
Yes, so in closing, I think it's important that you look out for all these signs and symptoms that we've mentioned. And it's important to not ignore any of the signs and symptoms. In fact, there is a campaign to say that people think that they can't get cancer, so they should always be suspicious. And if there's any signs or symptoms that they're worried about, they should go to their doctor and get it checked out.
Dr. Sabita.
I would like to say that information is important and the correct information is very important. So that is why, so have access to the correct information and follow the rule. Thank you.
Sudha.
Conscious, be aware of your breath to increase the pranic energy in your body. So you can do it anywhere, anytime. Thank you.
Thank you. Thank you so much. I thank our support from the marketing team led by Jitendra Nangia and rest of the people at the back end who have worked very hard to put it together. I thank everyone who participated in the program this evening. We would come back next month, 7 Tareekh, 7 Baje, with another episode. And I thank Dr. Trehan for the inspiration and the kind words. And we hope to continue with the program with a new episode, new discussions, and new empowerment. Thank you so much. Namaste. Take care.